Our Mental Health Awareness Month is annually commemorated from the 1st of May until the 31st of May. In light of this, we kickstart our own Mental Health Awareness Week with a discussion on why it's important not to only bring awareness to mental health conditions, but to provide a platform for discourse on a matter that affects more people than we're willing to acknowledge. Joining us this evening for this discussion, all the way from Korigas, is Alex, a Gomachab Mental Health Advocate. Alex, good evening and welcome to the Daily Roundup.
Good evening, Nina, and thank you for having me.
Alex, just to begin with, talk to us about, the advocacy work that you do.
Okay, so Nina, growing up and being exposed to different environments, I actually realized in seeing that there is very little or non-existent conversation around mental health in itself. It only got amplified during the COVID-19 pandemic period. So I was thinking, okay, so there is this space that has not been conquered, and that needs to be put into into light, because it actually impacts all of our aspects of our life. It impacts how we work. It impacts how we behave. It impacts how we do fitness and everything. So it impacts our behaviors, our personalities, and all those things. So I just started and thought, no, okay, let me try and see it to amplify this message and try and it can be seen as an important facet of our human existence, because there is so much stigma, so much stereotypes that exist around mental health. And up until I was able to read on mental health and study, for me, mental health was psychotic disorder. That was the way that I saw mental health. Mental health for me was suicide and depression.
Yeah.
And when I started to really dive into it, I knew that we needed to have mental health awareness, destigmatizing stereotypes. We needed to increase help-seeking behavior, and we also needed to increase access, because there's not a people that have access to mental health things, mental health services. Sorry, not because they are non-existent, but because they know what mental health really is.
Mm-hmm. That's so true, Alex. We'll talk a bit more, concerning access a bit later on. You work primarily with school-going children, and what has your observation been in terms of, concerning mental health conditions amongst the youth? What are they battling with?
So what I've realized mostly that youth are battling with is the understanding of what mental health really is, because of the fact that we are very cultural and a traditional and a religious society. Mental health is actually not given the I don't actually want to say the place that it occupies in delinquency or bad behavior, but that there is that layer or underlying factor of mental health that impacts all of the children. And that because they cannot communicate their mental health issues, because they do not understand the emotion that is the tool behavior that they it is just seen as violent, or it is just seen as acting out, while youth do not actually have maybe the confidence to give consent when they need to give consent, or when they feel angry and violent. It might be a problem at due to a broken home that impacts it, or if they're abusing alcohol, it might be a coping mechanism because they're trying to escape poor grades or insults from school, or they might be having learning disabilities. So what I've actually realized is there's really a lot of communication gaps between kids and their caregivers, kids and their teachers, because also the older generation doesn't understand what mental health is, because it's a fairly new topic that is within our society, and everything is seen, like I said, from a cultural, religious, or a traditional background.
Alex, what would you say, talking about caregivers and teachers and so forth, what role would you say parents and guardians need to play, not only in protecting but harnessing healthy mental capacity within their children?
What I've realized and what I've experienced, what I've got from my conversations and from my engagements, first of all, is, parents and teachers should always have a safe space for kids and learners where they can actually express themselves freely and authentically, not to allow disrespect, but to be able to talk about something that bothers them, maybe a sexual a perimeter, or sexual, something that is related to a sexuality, or something that is related to suicide. So I think first of all, parents must create that safe space, non-judgmental safe space, where kids can come to them so that they can have those conversations. Also, that as Stephen was saying previously, we really need integrated services where services are not in silos, or services are not in isolation, so that young people can actually be able to access those things when they need to, so that they are also youth friendly, so that they are spaces where kids can go and not feel judged, and believe and have the confidence that this space is a space that will keep my things confidential.
Yeah. Alex, you mentioned the issue of access earlier, and just as we round up our conversation, talk to us about, where, individuals who do have mental health, conditions, who are seeking help, where can they go?
So, the important thing with what I found out with mental health is there is access, but it is very limited. And it is also done in isolation, especially when it comes to public sector mental health services and facilities that are available. For example, Ministry of Health and Social Services, they provide social workers for 18 and above. Ministry of Gender Equality, they provide from 0 to 18 years. There's Ministry of Defense and Ministry of Education that provide support. Silos that we do not actually know it, or that we do not actually have the confidence, because of the stigma that is attributed to these things, that we don't have the confidence to go to it. So what I also mentioned, the objectives that I mentioned in the beginning, what I'm focusing on is not that the access is not there, but the access is available, but how do we approach that access that is there? And is the access adequate for us as well?
Yeah. Alex, it's lovely having you on the show this evening. That's all the time we have, but thank you so much for your time.
Thank you so much, Nina, and it was a pleasure being on your show tonight.
That was Alex Gomachab, Mental Health Advocate, speaking to us in lieu of Mental Health Awareness Month. Now it's on to